Hi everyone, this is Shalli Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK, a NMC registered nurse with lots of clinical experience and educational experience in supporting undergraduate nurses in UK and also overseas nurses. So welcome back to my YouTube channel. I'm back with another video for you. So if you do like my channel, please press like and subscribe. Share it with your friends or colleagues who may be preparing for NMC OSCE, and keep those comments coming. They really do help to keep me going. Okay, so I'm really hoping these videos are helping with your preparation for your OSCE exam. So we are going to go into another NMC OSCE video today. This is a really important one because you just need to know what is part of your syllabus clearly, simply and clearly for your APIE stations. Okay, there are lots of rumors out there or confusion about the scenarios, what can come, what is part of the syllabus, what's not part of the syllabus. So we're going to put all those rumors to rest today, all that confusion to end today. I'm gonna very simply and clearly explain it to you what are the scenarios in your syllabus for APIE and how the patient may present, and what you're supposed to do in a very summarized way. But by watching this video, you will be absolutely clear what is part of your syllabus, what scenarios they are, what are the presenting symptoms of those patients, and then whether they set in community or hospital. And we also going to quickly talk about the presenting symptoms so you understand what you need to do in those scenarios. Okay, so that's the aim of today's video. So keep watching. So let's get started. So you should know that in adult NMC OSCE, we are talking about here, adult NMC OSCE, there are 10 APIE scenarios which are part of your syllabus. APIE means assessment, planning, implementation and evaluation. Okay. So they make your 4 stations in your exam out of the 10. 4 are APIE, 4 are clinical skill, 1 is professional value, and 1 is evidence-based practice. Okay, so we're talking about APIE today, and there are 10 topics. You could say topics or scenarios or diagnoses, whatever you want to call it, but there are 10 APIE scenarios in your exam syllabus. Okay. Moving on to the next screen. So assessment, planning, implementation and evaluation, all 4 stations are based or connected to each other, and are they based on same APIE. Okay, so it's not like you're gonna get a pneumonia scenario for assessment and for planning you're gonna care plan for subdural hematoma. No, if this is patient journey. APIE is patient journey from assessment to you handing over your patient to somebody else in evaluation station. So assessment is assessing the patient clinically, and then planning is writing care plans, implementation is giving drugs using the MAR chart to the same patient, and then evaluation is handover. Okay, but they're all based on the same diagnosis, same scenario. So which will be one out of these 10 I'm gonna show you on next screen. Okay, so it is all connected. It's a patient journey. Simple way to look at it is a patient journey from when you admitted them or assess them to when you hand over to somebody else, and in between you plan for their care and give them drugs. Okay, it's all connected to one patient scenario. Rest of your exam is not connected to APIE. Your clinical skills can be anything, any 4 skills out of the 20, and your professional value topic can be any 1 out of 11, and your evidence-based practice can be 1 out of the 12 topics. Okay, but we are just talking about the APIE today. So let's have a look what topics or scenarios are part of your syllabus, and then we will then talk about how your patient present, what's the story behind the scenario, and we will talk about that. Okay, so let's move on to next screen. Let's see what are the 10 scenarios which part of your adult. I'm talking about adult NMC OSCE. Alzheimer disease, chronic heart failure, community assessment. I will talk about that in the next screen in a minute, so just hang on to that. So there is a community assessment in there. Ectopic pregnancy, end of life, fall and fracture, hernia, homelessness, pneumonia, and subdural hematoma. Okay, so these are the 10 topics which are part of your syllabus. These are the 10 diagnoses, or you could call it 10 scenarios, which are for APIE, and you will get 1 out of these 10 on the day. For the whole APIE, for assessment, planning, implementation and evaluation, it will be one of these scenarios. Okay, so let's move on to next screen now. Now you know which 10 topics there are. Let's see what they are and how they present and what you're supposed to do with it. Okay, so it's kind of an overview of your 10 scenarios. So let's have a look at the next screen quickly to tell you what are these scenarios, okay, how they present. Moving on to the next screen, Alzheimer disease. So this scenario is normally kind of set in community setting. It means your patient may be still living at home, or they may be in a care home or nursing home, and GP has asked you to go and do an assessment on them because they are presenting with progression of Alzheimer with increased memory loss and confusion. Okay, so your GP has asked you to go and do an assessment on them. From there onwards, from assessment, then of course on the same scenario, then you will write care plans, and then on the same scenario you will be given mark chart to do your implementation station, and on the same scenario then you will hand over your patient to another person who will be looking after your patient. It could be the nurse who will be coming back to see the patient in a week or so time, or it could be you are handing over to the GP your findings. So that would be your Alzheimer disease. So the main presenting symptom of the patient is confusion and memory loss, and you will be also asked to complete as part of your assessment station. Of course, you will need to do vitals, A to E assessment. You need to plot the vitals on the news chart, but alongside that you will also be expected to do cognitive impairment test, which I talk about in my other videos. I will put the description of the video to the below description. I will put the link of the video to the description below, so you can go ahead and check what is cognitive impairment test and what you need to do about it. And then of course that is part of your holistic assessment for that Alzheimer scenario. Okay, so there is already videos done on Alzheimer scenario. There is video on cognitive impairment test. So I will put the link for both of them in the description below, so you can have a detailed look at that scenario. So that's that one, and we're moving on to chronic heart failure now. So chronic heart failure is your patient who's got obviously chronic heart failure. They present, so it is definitely set in hospital. So your patient is presenting with shortness of breath. Your patient is probably presenting with peripheral edema, like edema of the legs, of the ankles. So they may be additionally struggling with mobility due to edema and swelling in the legs, and of course they got shortness of breath, and they may be actually, due to shortness of breath, they may be experiencing quite a difficulty to carry out other activities of daily living. Mobility is one of them, but there might be other activities. They may not be able to eat that well as well due to shortness of breath, or maybe their sleep is affected, their mobility is affected, their ability to carry out other daily activities will be affected as well. So okay, so that's the chronic heart failure one. Presenting symptom is shortness of breath and peripheral edema. Moving on to the next one, which is community assessment. It says community assessment, but a lot of other scenarios are set in community. I already told you Alzheimer is, but this community assessment is mostly referring to the diabetic patients. So your type 2 diabetic patient who is in community, could be in a care home or a nursing home, and your GP has asked you to go and assess this patient. So they are type 2 diabetic, presenting with unstable blood glucose level. Okay, and they might be showing some signs of malnutrition due to long-term diabetes. So you will be asked to do a malnutrition universal screening tool on them, alongside of course doing your vitals and A to E assessment and plotting the vitals. This will be the extra thing you will be asked to do by your examiner. Is the must tool as part of the holistic assessment. Okay, so that's that one. Moving on to next one is ectopic pregnancy. So here the patient is of course is a hospital admission. The lady has come in with abdominal pain, acute abdominal pain, lower abdominal pain, and the diagnosis is ectopic pregnancy. That's why she's having acute abdominal pain, presenting with that, and then you're going to prepare her for surgery because she is going to be going to surgery later on. So it's one of your surgical scenario on the surgical side. she is pre-op on admission, but in planning she could still be waiting, and you may be writing pre-op care plans, or they might say she's back from theater now, so you will be writing post-op care plans. Okay, so that is something to watch out. And then MR, again in implementation you will give her some drugs, and then in handover station evaluation you will hand her over to the next nurse or senior nurse or doctor, whoever you're handing over to. Okay, moving on to the next scenario here is end of life. So this is your end of life scenario. Again, hospital admission, hospital based scenario. Your patient is presenting with, so this is normally a stage 4 oncology patient, or could be any other end of life patient diagnosis. Okay, but normally oncology, but can be anything. So end of life, the patient is on the palliative ward and presenting with pain, perhaps with again shortness of breath. Again, then there is ongoing other issues as well, depending on why the patient is end of life. So, but the pain and shortness of breath, nausea is a big thing as well. So nausea will be there for this patient. So that's just the kind of nursing needs which you can assess. So I'm just giving you guidance with that. So that's that one. And then fall and fracture is normally the presenting symptom is the patient had a fall and then they fractured neck of the femur. So that's that one. And of course pain might be there, but once you kind of stabilize the patient in the bed, pain may not be the main theme, but the patient of course is bed bound now. But of course you'll be looking into these things. Okay, so that's kind of presenting symptoms of that scenario is that patient is obviously had fractured of the femur, in pain, and now patient is bed bound. Sometimes they might have history of incontinence as well, and you got to think about the skin integrity as well because patient is bed bound. So those things. Moving on to the next one, hernia. Now this is your elective surgical scenario. So the patient is going for elective hernia repair. So that's that one. So again, preparation for theater is the kind of main theme there. And of course, do think about, does your patient patient may not have present with pain because it's elective surgery they are coming in with. It's not like ectopic pregnancy who presented with pain. This patient may not be in pain to start with in your pre-op in your assessment, but you will talk about like preparation, safe preparation for surgery, and also need for is the patient anxious about the surgery, things like that. Okay, and again preparing them what will happen with their post-op pain, how will that be managed, how will their wound be managed. So those are the things you can discuss in holistic assessment. Of course, in all the assessment scenarios you still need to do patient vitals, APIE assessment, and charting. Okay, but this is, I'm more talking about the holistic assessment where you need to talk about the nursing needs here. Okay, next one is homelessness. So that's no diagnosis in itself. It's just that patient is homeless, but normally patient is presenting with pain because they have developed a leg or foot ulcer, whichever one. Okay, so the patient is presenting with pain. Obviously the mobility is difficult because they got leg or foot pain, and of course there is always a risk of infection in that ulcer. So those are the main themes in that one. Moving on to the next one is pneumonia. So again, of course, that's going to present with shortness of breath for sure, maybe some cough, shortness of breath, and maybe then shortness of breath is then affecting their ability to move around, mobility may be affected, their appetite may be affected due to pneumonia. So those are the things. So there might be a risk of malnutrition. So those things, because patients got pneumonia, so they are going to have probably loss of appetite, and that would definitely affect their nutritional status. Moving on to the last one out of the 10 is the subdural hematoma. So this is the only scenario which you complete the Glasgow Coma Scale because it's a neuro scenario. So your patient is presenting with a history of worsening headaches, nausea, possibly confusion, but you will figure that out when you do their Glasgow Coma scale. So when you talk about confusion and you will ask them questions, so then you will see if they're confused or not. But headaches and nausea is definitely the theme there with the subdural hematoma. So these are the kind of, I wanted to tell you what 10 scenarios there are and how the patient will present. So you have a clear idea that nothing is going to come out of syllabus in your exam. So you should be confident that if you prepare for these 10 scenarios for APIE, that you will be given 1 out of the 10, because there has been a lot of rumors, because there were a couple of additional scenarios in the beginning of the year, but they have taken that out. But a lot of nurses are still confused about it. So that's why I just wanted to very clearly tell you that these are the scenarios now, this is your syllabus, and that's what you should prepare for, and give you some theme of every scenario, just an overview what you can expect the actor to behave like, or the patient to present with. Okay, so I hope this helps. If you do like my videos, don't forget to press like and subscribe. We give full NMC OSCE training for both adult and pediatric. So you can contact us on oscenursetraining@outlook.com, or go and see our website oscenursetraining.com, and go and check our Google reviews, what other nurses have been saying about our training. We do provide training both in Cambridge and in Manchester now. So if you want to get in touch, please do contact us, and I will soon be back with another video for you. So bye for now.